Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I have like 3 years with
Jaw pain?
jaw pain and tinnitus.
Tinnitus, okay.
And I went with different doctors and
So
physical therapy.
So you what kind of treatment you had, like for your jaw? You said physical therapy. What else?
And then I have like
Massage. Appliance. You tried appliance, okay.
I try appliance.
And you had massage.
Massage.
Okay. So how your jaw pain started? How did you hurt your jaw?
I went with my sister and we're on a ride. And then something is like put the brake and then I move and boom.
So you had a motor vehicle accident and you get hit from the side?
Yeah.
The car hit in the side and your head hit the window?
Yeah.
Back and forth.
Yeah.
And that's been going on for the last 3 years.
3 years.
Yeah. And how much you rate your pain from 0 to 10? 10 is emergency room.
Like 6 or 7.
6 or 7. Is that constant pain or comes and goes?
Constant pain.
Constant pain. Do you experience any headache?
Yeah, every day, almost every day.
So you have like a constant headache. And where do you feel the headache and how much from 0 to 10?
I feel my headache here.
Okay.
Like this.
Like this.
And then I feel like inflammation here.
Swelling in that area. And the headache, the jaw pain been going on for the last 3 years.
Yes.
Okay. Any other symptoms in the neck and the jaw area?
I always touch my neck because
it's tight.
Yeah.
Okay.
It's very tight.
Very tight.
Yeah.
Okay. So we're gonna work on that too. Okay. It's about 3 centimeters, 30 millimeters. And you said like you're losing around like you can come in the front. You're losing like around 40% of your range of motion or 20%.
Yeah,
of your
like,
jaw.
Yeah, 40%. I think.
Yeah, it's limited. The normal is 35 to 45. You are 30. Yeah, we'll work on that. So let's turn your head to the right all the way. That's tight. The other side. That's tight. 2 backward. And you tell me how much pain, okay? You're very tight. And forward. Yeah, her range of motion is very slow. Where did you feel the pain and how much?
When I go to the front.
How much from 0 to 10?
Like 6.
Is it painful? You feel those bumps here?
Yeah.
All of that scar tissue. So I'm not really surprised because you had that accident, you had that area. So all the scar tissue. You feel those bumps. Scar tissue.
I feel better. Only the clicking.
Only the clicking, but you open wider. Yeah.
Yeah.
Let me work on your neck because it's very tight. How does it feel here?
Good.
Feel relief?
Yeah.
That's good. Okay, we're gonna do the same thing on this side. Feel this tightness here?
I cannot sleep with the pain.
You cannot sleep because of the pain of your arm. Let me see your range of motion for your arm because you said you have an arm issue. Let's lift this arm. Wow. How much pain from 0 to 10?
Like 6, 7.
Okay, let's do the front. No, like this. Can you do that?
No.
Okay. So relax this arm. Okay. Let's do this. How much pain from 0 to 10?
Like 5, 6.
5. And the side?
No.
Thumb up when you do that. Turn thumb up. Okay. And you said you had this pain after someone worked on it?
Yeah.
Yeah, so you had normal range of motion for someone work on it, and they were very aggressive
Yeah.
with the mobilization on your shoulder. So we have a couple of issues here, working on it. Okay. Look at that.
Oh my goodness. That's great.
All right, let's do the side. Oh, look at this. Look at this.
Oh yes.
Yeah, are you trying to show off?
Wow.
You're trying to show off here? All right. So we just worked on 2 spots here that cause the tightness in the shoulder. That's good. Yeah. Yeah. So let me do another spot here and see if we can get you more range of motion. Okay. Front. Almost there. That's beautiful. Okay, let's do the side. Look at that. That's a full range of motion. Look at this.
Wow.
Look at this.
That's pretty good.
Let's do the front and tell me where do you feel the tightness, because you feel it right here. Okay.
Yeah.
Let's do this. You're originally coming for your jaw, yeah?
Yeah.
Okay. Let's see, after working on this, how you feel. Look up nice and tall. Up. Look at that. That's beautiful. Okay, let's do the side. All right, awesome. That's good. Okay, let's open your jaw and tell me how you feel with your jaw. How's that?
Very good.
Yeah, do you feel that's your normal range of motion?
No.
You still need... Okay, where do you feel the tightness now when you open your jaw?
Here.
You feel it in that side? Okay. Let me know if it's too much, okay? So, back and forward. How's that?
Better.
And turn left and right. Move your shoulder. Beautiful, that's nice. Okay, so let's take your range of motion for your jaw. So it was 30. Okay, look up nice and tall. Yeah, it's 34, almost 35. Yeah. All right, so tell me, what do you think about ASTR treatment?
Oh my God. I can't believe this. Really.
Yeah.
Thank you very much.
Yeah, do you feel any pain or the pain is gone?
No pain at
So
all.
the 7 out of 10, no
And
headache?
when I'm here,
Yeah,
oh my God, I can stand the pain.
yeah.
Yeah.
So the headache is gone, the jaw pain is gone, the shoulder pain is gone?
Yeah.
Right, awesome. Thank you so much.
Thank you.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.